All right. The Elder Services Provider Council is a networking group of senior care professionals here in Frederick County with a mission to support our members and seniors and their caregivers here in the community. Many of you have attended our Caregiver Conference, which we hold each October in conjunction with the Elder Expo. And unfortunately, because of the pandemic, we've had to cancel those events. Instead, we've moved to this virtual format where we hope that we can share with you information and resources from experts in our community to help you do your job just a little bit easier. We know what you do is difficult, and we know that this pandemic has made it even harder. Tonight is the first of our webinar series entitled A Compass for Caregivers, Finding Your Way. Tonight's topic is navigating the pandemic. Before we begin, I want to go over a few things about Zoom. First and foremost, let me tell you that this is our first time doing this. So we are learning. I ask for your patience. If this does not go off as we have technically hoped it will, I hope that you will come back and try us again. We are learning ourselves, and I imagine some of you are still learning too. Please don't give up on it. If it doesn't work for you, I encourage you to please take advantage of our free Zoom training. Many thanks to the Frederick County Senior Services Division for offering free training for those that were interested. Thank you to Dara Markowitz at the Senior Center for doing that. If you sign up for next month's webinar, you'll have the opportunity to sign up for training then. So I think this technology is here to stay. We're going to be doing things virtually for a long time. So mastering this is a great skill, and I can tell you from my own experience that practice definitely makes things easier. Still not perfect, but makes things easier. I'm going to do my best so that you see just the speaker on the screen. Please know that in this webinar format, we can't see you and we can't hear you. So you will see on the bottom of your screen, there's a toolbar. And if you don't see that, you can hover your mouse and you should make it come alive. You'll see a Q&A button. You'll also see a chat button. That's how you're going to communicate with us and ask questions. So please use that chat if you have a general technical question. Please know that we may not be able to solve very specific personal technical questions, but if there's something global going on, you can let us know. You'll use that Q&A button to ask us questions. You can, when you click on that, you'll be able to use your keypad to type us the questions. Sometimes we'll respond to you directly. I do have some fantastic co-hosts behind the screen who are helping manage the chat and the Q&A and the other technicalities of our program. So they'll be watching that, and we'll save the questions for Dr. Culpepper for the end of his presentation. So do please ask those questions as you wish. Okay, before we get started, let me reorient myself. Before we get started with the program, I'd like to get to know you just a little bit better. So we've got a couple of poll questions for you. So if one of my co-hosts could pull up our first poll, you'll see that pop up on your screen, and you can use your mouse to answer the question. Our first question is, all right, so we're going to launch that poll, and I'm interested to know who it is that you are caring for. Are you caring for a parent, a spouse, an adult child, another relative or friend, or are you a professional here with us tonight? So I can see that the answers are rolling in. Thank you. This is a pretty cool technology. So thanks for engaging with us on this. So we've got just a few people who haven't answered yet, and I know some of you are here on a phone. I hope that technology is working well for you. And I'm pretty sure you can't answer a poll on the phone, but we'll tell you what the answers are. So at this point, it looks like most of our folks have voted. All right, and so it looks like we have quite a few professional caregivers with us tonight, and all of you, I thank you for joining us. And it's a pretty solid mix, 20% with a parent, 20% with a spouse, 15% with another relative, and 10% of you taking care of a friend. which is a pretty awesome thing to be doing. All right, I've got another question for you. All right, let's see. So we're gonna, give me a second, still learning. Okay, so our next question, oh dear. All right, we've already done that one. Drats. All right, McGee, I don't know if you're able to find our next questions. Just so you know, I was interested in knowing if you live with the person that you care for or care for them from a distance. And I was interested in your ages, but we won't get hung up on that. It's good to have you here regardless. We really have a great group here. We're thrilled for this being our first webinar, and I'm confident that you're gonna walk away tonight with some new information. So let's get us started. I'd like to introduce our speaker tonight, Dr. Randall Culpepper. Dr. Culpepper is the Deputy Health Officer and Medical Director at the Frederick County Health Department. He has been serving as the Incident Commander for Frederick County Public Health's response to the novel coronavirus pandemic since January, and he leads a team of over 140 professionals at the Health Department. Dr. Culpepper graduated from the University of Colorado School of Medicine, completed Naval Flight Surgeon training at the Naval Aerospace Medical Institute, and received a master's degree in public health from the University of Washington in Seattle. He's an assistant professor of preventative medicine at the Uniformed Services University of the Health Sciences, and he's held faculty appointments at a number of other universities and military institutions. Dr. Culpepper is board certified in preventative medicine and has consulted and lectured extensively on global emerging infections, biological warfare, and global biosurveillance. Prior to his retirement after 24 years of active duty service with the U.S. Naval Medical Corps, Dr. Culpepper held a variety of leadership positions in the Department of Defense and represented the U.S. government on various international committees, work groups, and task force. Dr. Culpepper brings a wealth of experience and leadership to his position as Deputy Health Officer and Medical Director at the Health Department. I've had the opportunity to listen in to Dr. Culpepper's weekly phone calls with our nursing home and assisted living communities, and I can tell you that Dr. Culpepper is an expert, but he's also an incredibly compassionate and caring person who really cares about this community. So Dr. Culpepper, I can't imagine how busy you are, but we are really grateful to have you with us. Now, give us a second and I will get Dr. Culpepper back to us.
I think I'm back on.
There he is. Fantastic.
Fantastic.
All right.
Thank you so much. All right. Well, thank you so much for the great introduction. And I do not make any apologies for my office. Einstein said that the image or the proof of a cluttered mind is a clean office. And so mine's not so clean. So I don't know what that means for my mind though. But anyway, thanks for the opportunity to talk to you all, and I'm looking forward to it. We're going to get right on. I'm going to go and bring up my slides, and we'll start the presentation. Christine, let me know when you can see the slides on your screen.
You're good, Dr. Culpepper. I can see it.
Fantastic. Let's get started. And so I give briefings all through the week to multiple groups across the county, all of our healthcare providers, behavioral health providers, our partners, our colleges, our non-public schools, our public schools, just pretty much everybody who could benefit from having the information. But we give these briefings, I give these briefings multiple times throughout the week. So I'm glad to be able to share it with you. So as of this morning, what you're seeing on the screen is a dashboard by the WHO and the Johns Hopkins University that's showing that as of this morning at 9:27, they're reporting over 20,666,000 cases of COVID-19 worldwide. Included with that are 750,371 fatalities. This is an increase of 1.8 million cases just over the last week. The country that we've been following, you'll see on the left of your screen, right up the top is the United States. The United States, for months now, has represented 1/4 of the world's total number of COVID-19 cases. Following behind the United States, we've been following these other countries such as Brazil, now with 3.1 million cases. India has been rapidly rising their number of cases. There are about 2.4 million cases now. Russia has been quickly escalating as well. They're just a little above 900,000 cases, followed by South Africa, Peru, Mexico, Colombia, Chile, Iran, and Spain. When we first started way back in March, 29 weeks ago, those countries looked very different at that time. At that time, we were looking at Spain and Italy and other European countries as really being very worrisome with the rapid acceleration of cases they were showing. But those countries have fairly stabilized over all these months. And now that we see several other countries have taken the lead behind the United States. But again, the United States represents 1/4 of all cases worldwide. Of those 750,000 fatalities worldwide, and that represents an increase of about 42,000 deaths in the past week alone. The week before that, it was 40,000 deaths. And so you may be hearing a lot about cases accelerating, but we're actually having numbers of fatalities also accelerating worldwide. Here in the United States, we're reporting a total by the CDC, a total of 5,119,000 cases. That's an increase of 371,000 cases just in the past 7 days. Represents an increase over 55,000 cases in the last 24 hours. The week before, it was only 42,000 cases. So we're still seeing an acceleration in those states that are having surges across our country. The number of fatalities in the United States stands at 163,651 deaths. That represents an increase of 1,244 deaths just in the past 24 hours. Represents 7,340 Americans dead in the last 7 days due to COVID-19. The week before that, it was 7,000 Americans dead due to this virus. What you see on this screen with the map of the United States is showing which states are having the highest number of cases just in the last 7 days. So of course, we still see those states we've heard about for so much now, Florida and Texas and California, but that may be because they're the largest states. But we also know that these states aired early on in early May and opened up their economy way before they were having any deceleration of cases in their state. Way too early. We knew it at the time. We predicted it. And not only in these states, but also in Georgia, South Carolina, North Carolina, Alabama, Louisiana, Mississippi, Arizona, Washington State, and many others. We knew that when they opened their economies right at the beginning of May, that they're going to start having surges of cases, and sure enough, they did. And they have just been almost out of control in some respects. Some of those states in the South and the West, they have plateaued, but that plateau is still an incredible number of new cases reported every single day. The plateau means they're just not having any acceleration of new cases reported. So this has been a big worry for us, a big worry for the country. And it's important that these states, all the ones in the darkest orange and the next darkest orange, it's important that these states get their epidemics, their pandemic number of cases under control and under control quickly. Several other states just recently in the past few days have started to have a relatively rapid surge of cases. And those cases are Illinois, Ohio, Kentucky, and Tennessee. So it's important that the country do what is necessary to be done to make sure that the number of cases in their state start to decelerate again. What happened here in Maryland is our governor waited, based on the advice of his public health and medical experts, he waited until we'd reached our plateau and then started decelerating. And we decelerated for at least 2 weeks, and that was the strategy. Wait at least 2 weeks before you can start having any reopening of our economy whatsoever. I think because of that, we've had a more successful response to the pandemic here in Maryland than many, many other states across the country. In Maryland, we are now reporting a total of 98,160 cases as of today. That's an increase of 776 cases just in the past 24 hours. That's significant. We had increases of over 1,000 cases per day in the past 4 or 5 weeks. We're reporting 3,483 total fatalities. That's an increase of 9 fatalities over the past 24 hours. These numbers of cases in Maryland represent 5,000 new cases just in the past 7 days. But the week before that, it was 6,500 cases. The week before that, it was 6,500 cases in the week before. So at least our numbers of cases appear to be decreasing week by week. Our fatalities, whereas not a single fatality is acceptable, this represents 68 new fatalities in the past 7 days. That's about the same as it was the week before. One thing of interest, as you see in that graph on your right, shows a bar graph with a line juxtaposed on it. This represents the 7-day testing average. And what this means is, of all the tests conducted on any one day in our state, how many are positive? That's the test positivity rate. And so for us, ever since in Maryland, ever since really the middle to the end of June, we had hovered right about 4.5% of all tests conducted were coming back as positive. That's pretty significant. Look what it was back in early to mid-April at the peak of our pandemic here in our state. We were upwards of 20, 25, 28% of all tests conducted were coming back positive. So we saw a gradual decline all the way till the middle of June, and then we plateaued for the longest time right about 4.5%. Recently, in the past several days, we've seen a decrease now of about 1 full percent, down to about 3.3, 3.4% now. And that's good news for our state. The other thing I'll share with you on this slide, on the left, your left, you can see several graphs. This represents all of the acute care and ICU beds in hospitals throughout the state. Again, look at the peak back in the late April, early May, and then look how it's declined ever since then. That is until the very beginning of July, when we started seeing an increase over the month of July slightly, but now that is starting to plateau and starting to come back down again. This represents the number of COVID-19 patients actually occupying acute care beds or ICU beds, and also represents the total number of beds altogether. So this is one of the metrics that we've been following here in Frederick, and I'll show you some slides about that in just a little bit. The number of confirmed cases total over time for our state, you can see here again, in late April, early May was really the point, the peak of our pandemic. Now, I remember lecturing to all of the folks in the county so many times throughout March and April saying, you know, when we get there, we're going to get there. And people will say, well, how do you know when you get there? Well, I know we get there after we got there. And that sounds silly, but you don't know that you've reached the peak until you start decelerating down the other side of that curve. And that's exactly what we did in the middle of May to the middle of, in the middle of May. And then you can see how that kind of declined all the way until about the very 1st of July. So what happened in July? What caused all of these new cases to start escalating in the month of July? We can only speculate, but we do know that we started seeing a lot of people just get frustrated with following the precautions, following the general principles that the governor outlined for us to continue using face masks, to continue physical distancing and things like that. We also saw a lot of people begin to travel. When you're told you can't do something, you really want to do it bad, right? So when we told people you shouldn't go to the beaches, you shouldn't go on vacations, they just did it anyway. And they weren't always so careful when they went. They weren't following the same precautions they did here. On top of that, they went to those states I just mentioned before that were having terrible escalation of cases. And so the risk was much different if you go to Florida or Georgia or South Carolina. It was much different than if they'd stayed here in Maryland. So a combination of things. We'll see a little more information later on about what's the age and what ages are we seeing with our cases now. But hopefully we're starting to see a little bit of a decrease, excuse me, decrease in the number of cases. This just shows you the testing volume. Clearly, testing volume does not correlate to the percent positive that we're seeing. I think what we saw, though, in April and May, why we had such a high test positivity rate, because we limited testing. We weren't allowing people who are asymptomatic to get tested. They had to have symptoms at that time. And the symptoms, quite frankly, if you had symptoms, you most likely were going to have COVID-19. So I'm not surprised we had about a 25% positivity rate for all the tests conducted during the early part of our pandemic. But despite having incredible increased capacity of testing throughout towards the end of June and throughout all of July, we are still maintaining in the state a relatively stable test positivity rate. This is really good news for us in the state. In Maryland, what are the age groups that are experiencing the most numbers of cases? During the height of the pandemic, the average age of cases in Maryland was about 45 to 55. And not a surprise, because we're having a lot of cases in our long-term care facilities, our staff in those facilities, our residents in the facilities, etc. But we've seen a distinct change in the population getting infected from the older folks now to the younger folks. And you can see from the slide, when you compare the far right-hand column to the middle column, far right-hand, that's the percent of cumulative cases. So let's take that age range 20 to 29. Of all cases so far, 17% have been in that age range 20 to 29. If you look at just the new cases, the percentage is now 21%. So we've seen an increase for sure in that age range 20 to 29, as well as 10 to 19. And this kind of goes along with what we've been saying with increased numbers of folks working in restaurants, increased folks that are visiting bars, increased numbers of folks who are going to beaches and hanging out the boardwalk at those in Ocean City, etc. And you've seen pictures, everyone's seen these pictures, and of folks just partying and not really monitoring their ability to be safe, unfortunately. Just a quick tour around the community, around the area. In Virginia, they're reporting 103,000 total cases and 2,363 deaths. In the District of Columbia, they are reporting a total of 13,000 cases and 594 fatalities in the District of Columbia. In Maryland, before I leave the state, just go back up a little bit. Some things we also measure in our community is the number of outbreaks in our state and also in Frederick. And when I talk about outbreaks, I'm talking about outbreaks in long-term care facilities, so nursing homes, assisted living facilities, group homes, hospitals, detention centers, jails. So all across the state, we've been seeing recently through the month of July increase in the total number of outbreaks in those facilities, where before we had really worked and gotten our numbers quite low actually. So 3 weeks ago, we had 110 total outbreaks reported in the state. This week, we have 327. So almost 3 times the number of outbreaks we had a few weeks ago, we now have in the state. Of those 327 outbreaks, and that's slightly down from last week, by the way, of those 327 outbreaks, 127 are in nursing homes, 67 are in assisted living facilities, and 49 are in group homes. One perhaps comforting aspect of this is that about half of all outbreaks really only constitute or have 4 or less cases. An outbreak in a nursing home is 1 case. An outbreak in an assisted living facility is 1 case. So it doesn't take much to be called an outbreak. But this is one metric that we've been following, trying to see if we're making any progress in our community. As far as testing, again, I mentioned that already. In Maryland, our 7-day positivity rate per test is 3.5%, down from 4.5% where it plateaued for so long, as I mentioned. But we have tested now 18.1% of all Marylanders since this pandemic began. In Frederick, we're reporting 3,154 total COVID-19 cases. That's an increase of 36 just in the past 24 hours. More than I'd like to see. We have had anywhere between 10 150 daily cases reported in the state. We had been doing well. We had been down around 9 or 10, 12 cases per day for a good while in early July. But when we started having a surge of cases in our state too, we started seeing this number go up. Again, 36 new cases in the past 24 hours represents a total of 98 cases just in the past week. The good news for Frederick is that we, again, not good news that we have any fatalities, but we're reporting 114 deaths secondary to COVID-19. We have not had a COVID-19 death in our county since mid to late June. So it's been almost 5 or 6 weeks since we had a fatality in our state, our county, and that's terrific. Our test positivity rate is 1.6%. It is the 4th lowest in the state among 24 jurisdictions in Maryland. Just to reemphasize, this is what our death rate was looking like. When Christina said I was getting quite emotional, and I am very empathic, I found out. I didn't quite realize it until this pandemic. But when you look at those deaths in mid-April and right on through until the end of May, it was just disheartening to see so many fatalities in our community from this virus. So it makes me feel so super happy to not have anything since the late June fatality. And we're keep keeping our fingers crossed. This is what is happening in Frederick Health Hospital for the hospital statistics for acute care beds. That's the green line, and the blue line are the ICU beds, and of course the black line are the fatalities. And so we see quite a jagged curve here. If we do a 7-day rolling average, that smooths it out a bit. But we've been doing very well here in Frederick. And the latest report just from today from the hospital this afternoon, what they shared with me was they have 3 people in the hospital right now with COVID-19, nobody in the ICU, nobody on a ventilator. In fact, they've only had 1 patient on a ventilator the past few weeks, which is really unusual if you consider what's happened to the worst part of our pandemic. So our picture here in Frederick looks pretty doggone good. And I will attribute that to many things. So I'm going to share with you, I think I attribute it to one, we have a remarkable community here. We have a remarkable partnerships, a remarkable sharing of information, and we have a remarkable community of people who for the most part, will do the right thing, as opposed to many parts of the country that they don't. I think we do. I think all of you have seen folks not wearing masks and not worrying about being physically distant from each other, but for the most part, I think we have a very good community who does do that. I think the hospital has been outstanding in providing the drive-through testing over there right now at the old State Farm building off of 26. The Frederick Health Hospital has accounted for about 2/3 of all tests collected in our community since the pandemic began. And they've done a terrific job. Now, they built that whole drive-through facility by the State Farm building. They don't make any money off that. In fact, they lose money every single test that they do. They're doing it for the community. I think here at the health department, we've got a great group. I've got 141 people right now that have been reassigned from all their normal positions as school health nurses or school health technicians to infectious disease outbreak investigators to people doing pool for opening pools, to do everything you can imagine, have been reassigned to work 100% on this COVID-19 pandemic response. And it's an amazing group of people. I have a nurse assigned to every long-term care facility in the county. I have nurses assigned to every child care facility in the county. I have nurses assigned to every group home, to the detention center. We had a nurse assigned to the hospital. We have them just there to try to help navigate what has been a ferociously fast-paced pandemic as far as information learned and information having to digest and figure out what's going on. The volume of information coming from the CDC and the Maryland Department of Health is overwhelming. And I can't imagine any facility could have the ability to not only manage and take care of your facility, but be dealing with how do you interpret this new guideline or this new recommendation, et cetera. So it's been something. My finger twitched, so I went ahead to the next slide. Sorry about that. But this is It shows you the percentage of cases at each age group. I think it's kind of interesting. The yellow band, which represents those folks in their 20s, you can see early on the left part of the screen, they're representing only 7 to 10 to 15% of the total cases. Whereas now that age range represents 25% of all cases. And I think the good news is, I think it's important for everyone here to understand this, particularly this group, is that early on, our elderly were really suffering terribly the burden of this disease. You can see on the far left, starting with just from the very beginning, you can see that the 50s is a dark blue right in the middle, 50s on up. You can see what a terrific burden the elderly had from this number of cases. And so you can see how, take the blue all the way up to the light blue to the top, how that has gotten smaller and smaller and smaller as you go to the right side of the curve. And that's terrific. Our goal, the nation's goal, but our goal was to do two things in this pandemic, was to protect the vulnerable population, and that's the elderly mostly, and those with significant comorbidities, and protect our healthcare infrastructure. If we had surges of cases like we're seeing now in Texas and Southern Florida and many other areas where the hospitals are overwhelmed, if that had happened at Frederick Health Hospital, we couldn't care for anybody else because we still have heart attacks and strokes and everything else that needs to be cared for. We wouldn't have the ability to do that. So we knew from the beginning we had to protect the healthcare infrastructure. I think we as a community did a doggone good job doing that. This is just, again, showing the Frederick positivity rate. We've always been below the statewide positivity rate, but we both peaked about the same time, but we're doing well. We are doing well and have been since early July, and we continue to decrease up and down a little bit over the past few weeks. And so just a few more slides. What can you do to stay safe and healthy? And as caregivers, it's incumbent upon you to stay healthy and protect those that you're caring for, protect your loved ones, and protect those that you're working with. It really is, that's really the key. It's important for you to keep those folks safe and healthy as well. So what can all of us do to stay safe and healthy? And this is going to be kind of sophomoric for most of you because you all know these things. I'll go through a couple of slides I put together anyway. And so Governor Hogan, when he wrote his roadmap to recovery and released it in May, as you know, there were some gating criteria that we had to pass to be able to get to where we could even open up the first phase. And those gating criteria were make sure we had enough PPE for all of our long-term care facilities and our hospital, make sure we had enough surge capacity in the hospital in case we had surges of cases, make sure we had adequate contact tracing. So if there are cases, we can find out who the case is and find out who the contacts are and get to those contacts and put them in quarantine. So those are some of the gating criteria. But he said, no matter what phase we go into, there were some general principles that had to be adhered to the entire time. Those general principles are, number one, you maintain physical distancing. Number two, you maintain using a face covering. And number three, you telework to the maximum extent possible. And we're still doing those things since he released that document in May. And so it's no less true today than it was 3 or 4 months ago for sure. We've got to maintain our physical distancing when we're in crowds. We're likely to be near other people. So it's important as a caregiver, it's important for those that we give care to have everyone limit the contact with others as much as possible. If you're going to be in contact with other folks, stay at least 6 feet away from those others. Avoid gatherings with more than 10 people, including family. I can't tell you how many times we've seen family gatherings occur and we have outbreaks in those family gatherings of COVID-19. I realize that your own personal family is probably safe, right? It probably is okay to gather with of course, your family members. A funny story. I walked into our cafeteria this afternoon. I noticed a couple of women in there were eating. I recognized one, I didn't recognize the other, and they're sitting right across from each other from the table. I had just cleared out our cafeteria a week earlier saying, guys, we can't be eating together without your mask on. We just still can't be doing that, please. And they were fine. They all left. So I went in today and I said to the two ladies, I said, y'all can't be eating together like this. You have to be 6 feet apart. And they looked at me and said, well, that's my mama. She's working with me at the health department now in this new task I've been working on. So their daughter and mother and daughter, and they said, all right, that makes perfect sense. Since y'all live together in the same household, you can certainly stay together. But think about family gatherings, and especially the little kids. Little kids like to jump up on grandma and grandpa's laps and play, and we have to be careful if they don't live with that family all the time. And finally, outdoors is better than indoors for safety, for sure. You're less likely to get sick if you're near folks outdoors than you would if you were in a small 12 by 12 room with someone who's infectious. And of course, I emphasize many times, wear the face coverings. No one likes to wear face coverings, right? I'm not thrilled about it, but it's important. It's important to do. It's easy to do. It's not hard. Just wear the face covering and keep yourself safe. Personal safety is important. It's inherent. It's important for all of us to wash our hands, sanitize our hands, keep from touching our mouth, nose, and eyes. This is the things we've been preaching for decades for prevention of influenza every year. It's important to continue to do this. Wash your hands, keep them clean. We really don't know the role of fomites in the transmission of this disease. And what I mean by fomites is if someone were to cough and sneeze onto a surface, and then you go later on, whether it's a doorknob or an elevator button or a desk surface, and you touch that surface with your hand later on, where that virus had probably been spread by the sneeze or cough, you may be able to pass that virus from now being on your hand by touching your eyes, touching your nose, touching your mouth, etc. If you don't think that's true, just watch people for a few minutes and just watch how much they do touch their face, their nose, and their eyes, and their mouth. So anyway, keep that in mind. And as you're driving down the car, I know you all have seen this. I've seen it millions of times. The guy beside me driving his car is picking his nose as big as he can, get as many boogers out of his nose as he can. And then that's the guy I'm going to meet in a meeting in 20 minutes and shake his hand when I come to the conference room. No. So don't shake hands, don't hug or touch others outside of your own family members, please. It's just smart medicine, isn't it? Just a good way to stay safe. So wash your hands, use hand sanitizer if you can't wash your hands, and then avoid touching your eyes and mouth. What can you do while you're staying safe? So then people say, oh, you're putting me in prison. What can I possibly do and not be imprisoned by you telling me I can't be around people, et cetera, et cetera. Lots of things you can do. Just a few things. Right? The one thing I want to emphasize on this screen is really, I think, the power of laughter and how important that is in all of our environments to keep our sanity as healthy as possible. Because I got to tell you, this isn't easy, what we've been doing now for 29 weeks, almost 7 months. It's not easy for anybody. Certainly not easy for those for folks who are homebound and those that are frail and able to get out and about. So I think laughter is absolutely the best medicine of all. But there are lots of things you can do. And I encourage people, again, outside is better than inside. Go out for a walk, garden, go hiking, stretching, whatever you can do to make your day rewarding and fulfilling for you. Most importantly, relax. And you can't relax if you've got your phone in your hand and you're looking at the news feeds 22 out of 24 hours a day. I get it. It's kind of addictive. I get it. It's kind of hard not to do. Believe me, I know. It's hard not to look at your emails again because there may be something important there. But you've got to take breaks. You've got to get away from the news, quite frankly. We know for a fact, I spent a good number of years in the intelligence community here in the United States government. I know for a fact that there are countries that have been disseminating disinformation into our country to try to disrupt our political processes, and certainly trying to foment additional stress and anxiety about this pandemic. And this happens, it happens every day, happens worldwide. It's not just the United States, but this is what you do have here. So please choose your news carefully, choose your news wisely of who you listen to and who you believe, and just try not to be tied to that news 24/7. What else should caregivers do? Like I said right off the outset, the best protection for those loved ones that you're caring for is really for you to stay healthy and safe. Make sure others in the home follow the same guidelines as what you are going to do after listening to me today. Make sure that they follow the same things. Don't worry about being called out, of being a sissy, or being part of the establishment, whatever you want to say. But it's important just to follow those few rules of safety to keep everyone else safe too. Definitely watch, as you do as a caregiver, of course you do, but this is for the people you're caring for also. Make sure you tell them, watch for symptoms, watch for any new onsets of fever or cough, trouble breathing anywhere in the household, right? That's important. The symptoms that are associated with COVID-19 cover a whole host of different things. And the most common in 75% of all cases is cough, difficulty breathing, and fever. Those are the key ones, but we've had patients with nothing but diarrhea have positive tests for COVID-19. We've had people with nothing different, nothing more than simply a little change in smell or a change in taste. Those are actually two very key symptoms that we've been seeing that are associated with having a COVID-19 infection. So there's a whole host of different symptoms to watch out for. Just continue to monitor the CDC and listen to what is advised for what things to be looking out for. But watch for symptoms for anyone in the family. If someone in the family, if you're caring for the husband of a family and there's a son or a daughter who's sick, make sure that that person gets isolated or quarantined away from your person you're caring for. And that's the last thing I want to say, separate anyone who is sick. And so it's important to take care of yourself. The same things apply to you as applies to your family, their family, and everyone else. And really self-development, spirituality, community service, physical fitness, whatever it is that works for you, use that. Relax, take those deep breaths, stretch and pray if that's your calling. Take part in sacred practices, do activities you enjoy, especially do activities you enjoy. By all means, do things that you enjoy. Do not stay shut up inside of your home. Do not become a recluse. Do not be afraid of this virus and don't want to go outside. Go outside. Go outside. Just do those things I shared with you, physical distance and wear the face mask. Share your feelings. You've got to talk with others. I think that's really key. Allow your loved ones that you're caring for to share what they're thinking and what they're feeling. Ask them questions, and have also you have the ability to share your feelings and your thoughts with others as well. And stay hopeful. Think positively. We will get through this. I will promise you that. We will get through this. It won't be soon. It won't be next week. It won't be next month. It won't be in the fall, maybe not even the early spring. But we'll get through this. It might be a whole year from now. But you know what? We as a country have experienced so much more than this little pandemic. How many world wars have we experienced? How many Great Depressions have we experienced? How many other wars have we experienced? How many devastating outbreaks of diseases have we experienced? Polio, measles, mumps, all those things, smallpox, everything else. We've endured a lot in our country. And this pandemic will go away. I don't know when, but it will go away. And finally, write down things that you're grateful for, and write down things that are going well for you, and that helps to keep that positivity in your mind. So with that, I'm going to unshare my slides and take it back to you, Christina.
Fantastic. Thanks so much, Dr. Culpepper. Some great information. We've got some questions. Folks that are in the audience, please use that Q&A button on the lower part of your screen. You can type in questions. Dr. Culpepper, one just came in, and someone's asking about testing and lab results.
Absolutely, great question.
There are local labs that can get tests back quicker. Can you talk a little bit about testing, where to go, and what that is like?
I can talk a lot about testing. This is a huge issue right now. Because of all those surge of cases that occurred throughout the country in July, our national laboratories, Quest and LabCorp, literally collapsed at the end of July. July 27th, in fact, was a bad day for our national labs. They couldn't handle the load. And I'm not surprised. They never should have been asked to do that, but that's what happened. So our national labs collapsed. They have thousands and thousands of tests that are backlogged across the country. At one point, just a week ago, we had 3,000 tests backlogged at Quest, which is where Frederick Health Hospital sends their tests that they can't do in-house. I can share with you that that's improved a bit. That's good news. That they are improving a bit. I think this whole issue about national surge of cases will continue to impact our national labs for weeks and maybe months to come. And so Frederick Health Hospital has been the best source of testing in our community, I must share with you. At one point, they were getting test results back within 24 hours. But the problem is they also had surge of folks coming in asking to be tested through late June and all the way through July. In May, they were testing maybe 500 people a day. Now they were testing 300 to 400 to 500, 600 people a day. That's incredible. At the beginning, Frederick Health Hospital had one platform that they could do the diagnostic test, the PCR test, one platform that could run 350 tests per day. That number of tests was because of the reagents that are used to do those tests. And those reagents were allocated by the federal government. We could not get any more. Quest could, LabCorp could as much as they wanted, but our hospital could not. So once they reached 350 tests in a day, they had to send the tests out to the national laboratories. And that's what happened here in late July and early August. Through a combination of good efforts, they've been able to acquire another platform for doing PCR testing. Is just as good as the first one, and they're both excellent platforms for doing testing. And they have unlimited reagents for that new platform. And so they've been testing it last week. They went online this week. And we're hopeful now that we've doubled their capacity for doing in-house testing. So we're hopeful that they will do all in-house testing and get test results back in 24 or 36 hours. That's what we need to have, and that's what we'll have, I think. But that's really great news. So I think Frederick Health Hospital is still the ideal location. I'll share with you, just in case you do hear, we at the health department have set up testing sites around the county. We've set some up in Thurmont, Emmitsburg, Brunswick. We set up a permanent station, a site here in the Hillcrest area. But please, 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 these are specifically designed to reach those disadvantaged populations, those populations who have been marginalized and they don't have access to testing like most all the rest of us do. So please don't send folks to there. If like a college kid needs to have a test done, please send them to FHH, but don't send them to our facilities, because those are really designed to reach those very, very desperate people who don't have other sources of, can't get out and about to get testing. So please, because right now we're having college kids going back to college getting tested. That's not good, but it's obvious. I mean, college is requiring that no matter where they go. So anyway, FHH is still the best place to go. We can also get tested at 5 CVSs in the county. It's a drive-through testing. It works just fine. Test results come back. They're sending them out to a national lab. That's not Quest or LabCorp. The test should be coming back pretty quickly. The Walmart over on Guilford off of Route 85 also does drive-through testing, but that's only, I think, 3 days a week and limited number of hours. FHH, I'll just share with you, tests from 7 until 2 every day. But with the caveat that the temperature is over 90 degrees, it gets so blasted hot inside the drive-through testing tent that they have to shut down. So they've been shutting down some days around noon. but they're there at 7 in the morning for testing. And it's a great resource for us.
And that's at their new location, correct? Right at the old State Farm building on, is that Monocacy?
Yes, ma'am.
Okay.
Yeah, great. It's a great setup. It's unbelievable, actually. They took money out of their pocket to do that.
Perfect. Dr. Culpepper, we have a question about vaccines. Someone's asked, the virus mutating constantly, how sure are we that a vaccine would be effective? Tell us more about that.
Yeah, great question about vaccines. I'll give you a real quick brief. Operation Warp Speed is the federal government's effort to bring a vaccine to the market quickly. It generally takes 15 years. I've worked in many pharmaceutical companies, and it takes normally 15 years to bring a vaccine to market, because you start off with 1,000, 2,000 products at the beginning of the process. You finally get to phase 1 trial testing. By that point, you got maybe 15 products that might work in phase 1. You go to phase 2, you might have maybe 5 products that might work in phase 2. You go to phase 3, might have 1 or 2 products that work. You may not get anything that works after that. And so it is a really, really hard thing to produce a vaccine. I'm not worried about the vaccine mutating so much. And the vaccine is not mutating so much that you can't still produce a vaccine that will be targeting a certain proteins on that vaccine particle. So for example, this is a dumb example, but I'll use it anyway. All of us on this line round, there's 30 of us on the line right now. We all look different. We are not the same, but we all have a nose. We all have an ear. They might look a little bit different, but we all have noses and ears. We might look different though. And so if I can do a vaccine that targets the ear or the nose, then that's what they do. In fact, they target 2 different proteins on the virus, and those proteins aren't changing. There's other genetic elements of the virus that may be changing, but not the primary protein. So the U.S. government plans to bring 3 vaccines into phase 3 trials, and they're doing that now. The first one started in July, the next one starting in this month. The third one will start in September. I think the companies are, you've heard about Madrona. I can't remember the name of it. It's not Madrona. You all probably know. But the second one is a Pfizer product, and the third one's an AstraZeneca product, along with other partners. And so once you start these phase 3 trials, those sometimes can take 2 years to complete. So we plan on putting 30,000 people or more into the trials. And if we're going to do a multi-dose vaccine, which is going to be 2 doses for sure, it can be a 2-dose vaccine. I'd be surprised if it's just 1. It takes a while to get the vaccine in. Then you get a follow for months and months and months to see whether they're going to get infected with the virus. The only way to not take a long time is to do challenge trials. That's where you take 100 people, or 1,000 or 10,000. You give half of them the vaccine, half of them get a placebo, then you intentionally expose them to the coronavirus and see if they get sick. That's a little bit problematic, I think. So it's better to do a trial where you let nature decide whether someone gets sick or not. So you get 30,000 people, give half of them vaccine, half of them no vaccine, and see what happens naturally with infection. So after 3-4 months, if 15,000 of those 15,000 got that vaccine, half of them got protected from the virus, and that's great, and the other group did not, then you might have some evidence of protection. The threshold right now is to protect 50% of people against the virus, and that's the threshold right now. If you get a vaccine that's 50% effective, that'd be great. That's not unlike most of our flu vaccines that we have every year.
Perfect. We've got a couple more questions, Dr. Culpepper. We're pushing on time. So we've got a question, somebody asking about assisted living facilities and how many is each health department nurse responsible for, and how is testing handled in the facilities? And they're asking about the decrease in the resident population and the decrease in staffing.
Yeah,
What's
great
happening?
questions. Yeah, all great questions. So I'm looking at my list right now. I've got looks like 3 facilities. It depends on the facilities, right? So the smaller facilities, I've got 1 nurse assigned right now to 6 of our smallest facilities. I have another nurse assigned to 2, 1 nurse assigned to 4, one nurse assigned to 2, one nurse assigned to 3. So it depends on the facility and how complex they are. So all assisted livings with bed capacities of 50 or greater have to be testing their staff every week. And so far, and that's true for all the 9 nursing homes in the county as well. So far, the Maryland Department of Health has been helping pay for that testing and been sending those specimens out to selected laboratories that the health department has identified. Well, unfortunately, that support ends this weekend. So starting on Saturday, testing done by those larger assisted livings and all nursing homes for staff only will be done at a contract lab that the facility is contracting with. The problem with it, that's expensive. I know it's expensive. They're going to try to bill the insurance of the staff member. And if that doesn't work, they'll try to go to the federal reimbursement fund. If that doesn't work, they're going to charge the facility anywhere between $75 and $100 a shot. So that's expensive. I think it's time that we start thinking about pooling specimens. That is, you collect, let's say you got 200 people to test. And so for every person you take 2 swabs, 2 specimens, 2 nasal swabs, put them into a tube. When it gets to the lab technician takes 10 tubes, takes 1 swab out from every tube and puts them all into a new tube of reagent, of solution. Swirl it around and you test that 1 specimen, which represents 10 people. If that 1 specimen is negative, then all 10 people are negative. So if you do that for 200 people, you only run 20 tests as opposed to 200 tests. If one of that pooled specimen, if that specimen is positive, then you go back and you test all 10 individual specimens and find out which one's really the positive one, which one's the negative one. But you've really saved yourself tons and tons of resources, specimens, and money by pooling specimens. There's been a lot of talk about that from the CDC and now at the Maryland Department of Health. So I'm hopeful that will be where we're going to head in the near future. But it's not on the drawing, it's not finalized yet.
We've got a couple great questions, Dr. Culpepper. A question about someone who's had the virus, can they get it again?
Yeah, great question. There's not really good evidence that people are getting reinfected. Can they? I think they probably can. We don't know much about how long the antibody response lasts in our body. We don't think it's very long though, maybe a matter of months. So certainly someone who was infected in April may very possibly get infected now. We just don't really have good evidence. What we see a lot, and this will impact a lot of you guys, what we do see a lot are people getting tested positive, then they get tested again a month later, and guess what? It's still positive. And they get tested a month later, it's still positive. So the CDC, with all the data and evidence that we have, has agreed that anyone tested before or within 90 days of that first positive test, if they get another positive test within 90 days, it is simply it's not a reinfection, it's persistent viral particles in the patient's body. And so I believe that wholeheartedly. And so we are not seeing people generally get reinfected, but we're seeing persistent viral particles, viral RNA in the body that gets picked up by the PCR test. If it's after 90 days, it's a whole nother question. So we're using the threshold now of 90 days as being, you could be positive anytime within that 90 days. That's not a reinfection.
Our next 2 questions, I think, are kind of the same thing, Dr. Culpepper. So asking about the long-term effects. Once someone's tested positive, no longer has symptoms, are there ongoing concerns?
Yes. Yes. I think we're learning more and more now about maybe some persistent symptoms that some folks are having. I think we're trying, when I say we, certainly not me, I'm not smart enough for that stuff, but I know that our researchers are trying to figure out what it is that is related to that COVID-19 virus that causes these persistent, long-lasting symptoms. And then will there be long-lasting sequelae? Will it increase Alzheimer's symptoms? Will it increase other heart diseases? Will it increase other diseases? We don't know yet, but we're seeing some evidence that there are some, we've only been doing this for 5 months, so we're seeing some evidence of long-term consequences. Whether they'll go away, we don't know. Whether we're going to have more chronic fatigue type symptoms, we don't know. But we're seeing things like that now in some patients. That's a concern.
I think that wraps up our questions, Dr. Culpepper. I, again, want to thank you for your time, such a great information. Obviously, there's a lot that's still unknown, but you have really given us a lot of really solid factual information. And I hope that everybody on the call today has learned something new, something that you can share to help dispel rumors and myths. I want to share a couple of things with you. Dr. Culpepper mentioned masks and how important mask wearing is. The Elder Services Provider Council has been providing free masks to seniors in our community since the pandemic started, and we still have masks available. If you visit the ESPC website, www.espcfrederick.com, A, you can register for next month's webinar, and B, you can also sign up if you know a senior or if you are a senior that needs a hand-sewn mask. Those are generously donated by wonderful sewers from Project Linus, and we are happy to provide those to the seniors in our community to keep everybody safe. Our conference webinar next month is on telehealth. So again, we think that this technology platform is here to stay. There we go. This technology is here to stay, so I think we all need to get comfortable with it. I know a lot of the seniors that I work with have come to prefer those telehealth visits so that they don't have to get out of the house. I know for a lot of you as caregivers that those are daunting appointments to take some of your folks to the doctor. So telehealth, we hope, is here to stay, but we'd love to give you some tips, tricks, and strategies to make the most of it so that you're really getting what you need to, and the doctor's getting what he or she needs to make the most of those visits. So that will be September 10th, the same platform. You can register the same way that you did for this one. And again, I just made the link live, so you can do that right now if you want to. Again, going to espcfrederick.com. That's the Compass for Caregivers tab, or Mass for Seniors. So I really appreciate everyone being here tonight. Thank you for your time and for what you do every day. Please don't hesitate to reach out to ESPC if you have questions or want more information. Thank you all so much. Have a great evening and stay safe.
So is it just us now?
All right. Looks like it's just us. I think we can call it a success.
Indeed.
Well
Definitely.
done.
Great job.
job.
Oh, everybody, thank you so much for everybody's support. I think it went okay.
It went very well. Yeah.
Very well.
All right. So we just need to get together and figure out who's going to speak next month.
Well, I'm pretty sure that Margie had